The purpose of this program is to provide you with a better understanding of the medical diagnosis that was given to you or someone you know. This program does not provide specific medical advice. The information it contains should not be interpreted as a recommendation for a specific treatment plan or course of action, and cannot replace the advice of your own physician. What is right for any one person is an individual decision. You should consult with your doctor, who can discuss your needs, symptoms, and treatment.
Our medical director, Dr. C. Everett Koop.
We can plan for and anticipate many things in life, but illness is usually not one of them. What I have learned over the years as a physician, as the Surgeon General of the United States, and as a patient, is that understanding a health problem can make a real difference. Over the next 30 minutes, we will take you through the very issues you are probably wondering about right now. By the end of our program, you will have the knowledge you need to better understand what you or a loved one is faced with and what can be done about it. No matter what challenges lie ahead, it helps to be knowledgeable and to stay informed. So, stay with us, because we're going to help you do just that.
Hello, I'm Mike Schneider. There is no question that coronary artery disease is serious, and it can get worse over time. But it's also a disease that responds both to medical treatment and to lifestyle changes. Our program is made up of 4 different reports about coronary artery disease. In Report 1, we look at how the diagnosis was made and what is going on inside the body. In Report 2, we discuss what happens next. You'll learn about what kinds of follow-up tests to expect and what kinds of health professionals you may encounter. Report 3 explores options for treatment and management. And finally, in Report 4, we address issues that frequently arise. We'll be giving you a lot of information. To review it, use the booklet that comes with this program. In it, you'll find a place to write down questions and take notes when you're with your doctor, and a list of other resources that are available. Now, our first report.
Report 1. Understanding the diagnosis.
Imagine designing a pump that would perform around the clock, day in, day out, for decade after decade with no maintenance. The human heart is a marvel of engineering. To do its job, it requires oxygen and nourishment. And that's where the coronary arteries come in. Coronary, from a Latin word meaning encircling. The coronary arteries are the blood vessels that encircle the heart, and they're vitally important to its well-being.
The coronary arteries are basically pipes or tubes that supply blood to the heart muscle so the heart muscle can get the oxygen and nutrition it needs to do its work, which is to pump blood around the rest of the body.
And if there's any lack of blood supply to the heart muscle cells, then the heart muscle is not able to squeeze as forcefully enough or to pump the blood forward.
Coronary artery disease is a condition in which the arteries of the heart become narrowed, usually as a result of being clogged with a fatty substance called plaque. Your doctor might also use the word atherosclerosis to describe the process. The heart is a pump that is made up of muscle called the myocardium. The heart muscle, or myocardium, contracts, causing the heart to beat and pump blood to all the tissues of the body. Blood vessels encircling the heart, called coronary arteries, deliver blood to the myocardium. Inside the coronary arteries, blood carries oxygen and nutrients which the myocardium needs to function. coronary artery disease begins when fat, cholesterol, and minerals in the blood are deposited in the artery wall. These deposits form fatty streaks, which may develop into plaque. The process can occur slowly over a period of years, but eventually the artery may begin to close. The flow of blood is constricted, and the heart muscle doesn't get enough oxygen, a condition called coronary ischemia. When this occurs, the patient may feel chest tightness or pain, a symptom called angina pectoris, or simply angina. You may also hear it pronounced as angina.
If someone has funny chest pain, they shouldn't overlook it, but really should seek advice as to whether or not it has to do with their heart, because in fact then the next symptom may be a heart attack.
A heart attack can happen if a blood clot, called a thrombus, forms on the surface of the plaque. If it suddenly blocks the flow of blood to the myocardium, a heart attack occurs. This is also called a myocardial infarction, or MI. It may result in permanent damage to the heart muscle. A heart attack, as you know, can be fatal. It can also be a frightening wake-up call, as it was for Stanley Welch.
I was healthy as a horse until 1975, when I had what the doctors call an anterior MI. Certain job pressures had got the best of me, and I was really stressed out. And I tried to pick up this piece of metal out of the snow, and that's when it happened.
Doctors don't know exactly what causes one person to develop the disease while others don't, but they do talk about risk factors. For example, if someone in your family has had it.
Take a real deep breath through your mouth.
Doctors also consider your age and your race. African Americans are more likely to develop coronary artery disease. The chances of getting the disease also rise if you have high blood pressure, a high cholesterol level, if you're overweight, or have diabetes. And if you smoke cigarettes, you're dramatically increasing your risk. 30 to 40% of deaths due to heart attacks are linked to smoking. Now let's take a moment to review some of the words you may come across. Cholesterol is a fatty substance that can deposit in the wall of the artery and may develop into plaque. This buildup of plaque can lead to a condition called atherosclerosis. Your doctor may refer to the blockage in the artery as a lesion. When less blood and therefore less oxygen get through to the heart muscle, you have ischemia, which causes a painful feeling called angina pectoris. Those are two Latin words that mean choking and chest.
But the pain is not always just in the chest. It can also feel like an upset stomach, lower back pain, even a pain in the jaw. When a clogged artery is closed off by a thrombus or clot, a myocardial infarction or heart attack can occur, and preventing one is the primary goal.
Report 2. What happens next?
The severity of your condition and your overall health will determine what happens next after the diagnosis. The truth is, some things in your day-to-day life may change. You will need to take personal responsibility for scheduling doctor's appointments or remembering treatment plans, and you will want to know what may lie ahead for you.
The severity of your disease and how you're feeling play a role in what happens after coronary artery disease is suspected or diagnosed.
You may have already undergone or are about to undergo a stress test. The electrical changes in your heart can be recorded with an electrocardiogram, known as an ECG or EKG. Tests like these can give your doctor a more complete picture of the health of your heart.
In general, there is a sequence of tests that patients go through, usually starting with the simplest, working up to the more complicated and invasive procedure.
Often, deciding how to treat coronary artery disease requires inside information from coronary arteriography, also called an angiogram.
The angiogram supplies the physician with very important information regarding the anatomy of his heart. It, in essence, creates a roadmap, telling the physician where blockages are in the arteries and how severe they are and which arteries are involved.
The other thing it tells you about is what has been the consequence of the coronary insufficiency over time. Has the heart muscle been hurt?
The angiography is done in the catheterization laboratory, or cath lab, of a hospital. A catheter is a very thin tube. It is usually inserted into an artery in the groin or the arm. It is threaded through the blood vessels to the coronary arteries. A dye is injected that shows up on an X-ray, so your doctor can see what's going on inside the coronary arteries. The angiogram shows how well blood is flowing through the arteries, because the dye seen on the X-rays travels in the blood. A normal artery allows blood to flow easily. On this film, you can see where the flow of the dye, and therefore the blood, is pinched off. You can't see the plaque that's closing the artery, but the interrupted blood flow reveals its location. In this way, your doctor learns precisely where your artery is clogged.
As with all procedures, you should discuss with your doctor the risks involved.
So far, we've heard from several cardiologists, but along the way, you might be referred to other specialists as well, from a nutritionist to a cardiothoracic surgeon, who is a chest surgeon. Your primary care doctor may also play an important role, coordinating your care with specialists and then continuing to oversee it as you recover.
One of the roles as a family physician is trying to help the patient get back to their, quote, normal status in life as soon as it's reasonable.
Whether you're recovering from a heart attack or trying to prevent one, important decisions about treatment and management need to be made. That's the subject of our next report.
Report 3. Treatment and Management.
Your doctor will advise you on what treatment or management approach is recommended for you. It is important that once you have decided on a strategy with your doctor, that you do your best to stick to it. Make sure to take notes on how your treatment seems to be working for you, and let your doctor know how you feel about your progress.
Once your doctor knows how seriously your coronary arteries are clogged, he or she can decide what to do about it. Sometimes the need for treatment is immediate. When Ernest Wilms had his heart attack, his family doctor told paramedics to administer a drug to dissolve the clot, even before he got to the hospital.
And just about the time we got to the hospital, that pain quit all at once. And the doc said, well, that's when that clot started opening up and let the blood through. He says, when you was having that pain, it was doing damage to the heart.
The clot-dissolving agent and a nitroglycerin patch to relieve his angina saw Ernest through his crisis. After angiography, his cardiologist decided the disease could be treated with medication for the time being. Your doctor might prescribe one or more kinds of medications: nitrates or nitroglycerin to open the vessels, beta blockers to slow the heart rate, or calcium channel blockers to relax the muscles in the artery walls. Your doctor might also want you to take an anticoagulant to help prevent a clot from forming, and other drugs might be prescribed for lowering cholesterol levels or blood pressure. Medications cannot cure coronary artery disease, but for many patients, they can help control it.
So persons who are taking medications, many of them can be followed for many, many years, and depending on the risk factor profile, the progression of the disease, they may never require open heart surgery or angioplasty.
Open heart surgery and angioplasty are the two most commonly used procedures when it's necessary to go beyond medication. Angioplasty starts out just like an angiogram. The doctor inflates a balloon, such as this one, inside the artery to open it up. The balloon is placed on a catheter and positioned inside the diseased artery. Once inflated, the balloon compresses the plaque, opening the artery. Then it is deflated and retracted, leaving the artery open so blood can flow more freely. Some doctors followed the balloon angioplasty by inserting a stainless steel mesh frame called a stent. This works as a scaffolding to help hold the artery open.
It is common for patients to feel some chest discomfort. I also tell them and try to reassure them that I will let them know when that happens, so that they can anticipate, number one, that it's going to happen and that they will have pain, and also that they know that it's normal, and thirdly, that they know it will be short-lived, that I'm going to deflate the balloon, blood flow will return, and they will feel better promptly.
While relief is immediate, the effects of balloon angioplasty don't always last. Sometimes the procedure has to be repeated because the artery gets clogged again, or plaque builds up in another location. For some of those patients, and for many others whose blockages can't be treated with angioplasty, it might be necessary to consider coronary artery bypass surgery. Coronary artery bypass graft surgery uses a blood vessel from the leg or chest to form a bridge over a clogged coronary artery. The substitute blood vessel is grafted, attached, above and below the site of the blockage, allowing the blood to bypass the obstruction. As for double, triple, or quadruple bypass operations, the term refers to the number of blood vessel bridges the surgeon builds. Whether one bypass or four, it's a serious operation. It requires patients to stay in the hospital about 1 week. After that, several weeks of recuperation time at home are also necessary.
We're not actually curing the disease per se. It means, therefore, they have to be very religious in their rehabilitative efforts. Diet, hypertension control, exercise, avoidance of smoking, very careful control of their diabetes, control of their blood pressure. All of these things are extremely important and should be done indefinitely in patients following coronary bypass surgery.
I had no problem adjusting to a lifestyle change because as a result of these changes, I felt so good.
It has been 4 years since Stanley Welch had bypass surgery. With his wife's help, he watches his diet and gets regular exercise. But doctors say you shouldn't wait until you've had a heart attack or surgery to make changes. A healthful lifestyle is a must for all coronary artery disease patients. That means if you smoke, your #1 priority is to stop immediately and completely.
I think it is very important to understand that if you smoke as little as 2 cigarettes a day, it will put you at increased risk of having a heart attack. So when we talk about stopping smoking, we really mean stop.
A healthier lifestyle might also include joining a cardio fitness program in your area. It might be at the local Y or at a high-tech heart enhancement center like this one at Emory University. The important thing is to have a healthcare professional monitoring your new approach to exercise and diet.
In the beginning, when a patient comes into our program, we see fear as one of the first things that they have to deal with. Now they've been diagnosed with a heart condition and they don't really know how much they are able to do. Their family member may be saying, oh, you shouldn't do that, you know, because of your heart and that kind of thing.
After his heart attack 8 years ago, Tom Norton had to get used to the idea of exercising. He also had to adjust to a new way of eating.
And they put me on a 1,600 calorie diet, and I used to hate 1,600 calories for breakfast. This floored me, but I stuck with it. I was determined to stick with it. I even learned to drink skim milk and don't eat any ice cream. And my wife steamed all the vegetables and fish, chicken, and turkey, and no fried foods.
By bringing his weight down, Tom's diet reduces the strain on his heart. It's also designed to lower the amount of cholesterol in his bloodstream. The goal for most adults is a total blood cholesterol level of less than 200. It's also important to know the balance between 2 kinds of cholesterol, HDLs and LDLs, high-density and low-density lipoproteins. Think of them as little packages in the bloodstream carrying cholesterol. Those LDLs could be carrying trouble.
The LDL cholesterol is the bad cholesterol. It gets deposited in the blood vessel walls, and that causes cholesterol buildups and hardening the arteries and potentially a heart attack. The good cholesterol, the HDL, is like Pac-Man. It goes to the arterial walls and chews up the bad cholesterol and brings it back to the liver for further metabolism. So in summary, you want high levels of the high density, the good cholesterol. You want low levels of the low density or bad cholesterol.
So here are two more numbers you may hear when you get your cholesterol checked. The HDLs, or good cholesterol, should be above 35. The LDLs should be below 100. Your blood might also be checked for high levels of triglycerides. That's a kind of fat that is believed to contribute to the buildup of plaque in the arteries.
Your doctor will be keeping track of your blood pressure as well. Noreen Miller takes medication to control her high blood pressure. After 2 heart attacks and an angioplasty, Noreen is exercising and avoiding fat and cholesterol in her diet.
I could say from my standpoint that there isn't any reason why you can't carry on a fairly normal life with using good common sense.
Good common sense, backed up by knowledge. That's a powerful combination to have as you share the responsibility for managing your coronary artery disease with your doctor.
The secret is to work with the physician and understand that this is a chronic process. It's a disease pattern that will need chronic attention, but with proper medical care and proper responsibility on the patient's part, you can return to a very active, normal, healthy, productive life that you started with.
Making the best of your future means stopping smoking, controlling your blood pressure, eating a low-fat diet, and exercising. It also means being alert to the changes that may indicate it's time to get in touch with your doctor or even an emergency room.
There is no question that if a change in symptoms is not understood as being a bad sign, that's just as dangerous as ignoring the initial symptoms, because a change in symptoms means something inside the coronary arteries is changing, something inside the heart muscle is changing, and you're heading for trouble. It needs to be treated.
We're not here to recommend any particular treatment, but we can wholeheartedly endorse a healthy lifestyle and good communication with your doctor.
Report 4. Issues and answers.
By asking questions and discussing things, you give your doctor a better understanding of your specific concerns, and that's important. Do not hesitate to ask questions. In fact, it might help to write them down beforehand. You are not the first person in your situation to have those questions, and you won't be the last.
While we were preparing this program, some issues came up repeatedly. So while we encourage you to talk to your doctor about your specific concerns, we would like to take this opportunity to address some of those issues. And here to help us with that is Dr. Sidney Smith, Chief of Cardiology at the University of North Carolina. Dr. Smith, good to have you with us.
Thank you, Mike.
First of all, let's talk about something that we've heard so much about, and that is that people with coronary artery disease should take an aspirin a day. Is that true? Does it really help prevent heart attacks?
Absolutely. Aspirin can make a difference. If you have documented heart disease, first of all, during a heart attack or unstable angina, it cuts mortality. It can save your life. Secondly, we believe now, based on recent evidence, that patients with heart disease taking as little as 1 aspirin a day will have fewer heart attacks and live longer. Now, there are a couple things to remember. The first is you may have an allergy to aspirin. The second is you may have problems with bleeding or ulcer disease. Under those circumstances, ask your doctor first. But in general, aspirin is good news for patients with heart disease.
In contrast to something as old as aspirin, what can you tell us about some of the new cutting-edge techniques?
Well, there's some good developments there that are worth talking about. We've mentioned balloon angioplasty, but there are 3 other areas where we're able to improve blood flow in these arteries that are diseased. The first technique are the stents. Now, a stent is like a scaffolding which is on a balloon catheter and can be expanded to hold the artery open. The second is atherectomy. These are mechanical cutting devices that go in and cut away the narrowing. And the third is the use of laser technology. Initially, laser technology we thought held great promise. We understand now that lasers are good with very specific situations, smaller arteries, and what they can do is really limited. I think that the opportunities for stents and atherectomy are substantial and will make a significant difference over the coming years.
Now, there is another issue we should address, and that is the different kinds of fats. There's a lot of confusing information in the news about fats these days, so we asked a registered dietitian, Carol Thomason, what kinds of fats should be avoided and what kind of foods contain them.
The type of fat that a person with coronary heart disease should be aware of and try to decrease in their diet is saturated fat. Saturated fat is solid at room temperature. It primarily comes from animal products, and it does cause cholesterol levels to go up if it's in excess in the diet. Samples of saturated fat are meats, the fat around meat, cheeses, sour cream, butter, lard, shortening, those types of things. There's also an exception to that. There's two types of oils that are from a vegetable source, yet they're highly saturated. And those are what we call the tropical oils, palm and coconut oil. Those are highly saturated fats, even though they're not solid and that they come from a plant versus an animal.
Dr. Smith, anything you care to add to that?
Good advice there, Mike. Everyone knows that cholesterol needs to be lowered. Most people don't understand that it's fat that raises cholesterol as well as cholesterol itself. Average American eats 37% fat. We need to get it down below 30%. The bag of potato chips you see that says no cholesterol actually has 50% fat and can raise your cholesterol. So very important to listen to the message and avoid fat in your diet.
Another issue that patients with coronary disease often face is depression. To get more information about that, we spoke to psychologist James Blumenthal, who does research on depression and coronary disease.
It's been estimated that people who are depressed after a heart attack may have up to 5 times the risk of dying compared to cardiac patients who are not depressed. So this is something that we're very concerned about. And fortunately, there are treatments out there that are available for the cardiac patient who is depressed. There are a number of newer medications that are proven to be extremely effective in reducing depression. And also there are a number of psychotherapies that are available, newer psychotherapies, cognitive therapy, for example, that are successful in reducing depression in cardiac patients. So there is help available to patients who need it.
Here's one question I'm sure you hear all the time these days. Can you actually reverse coronary artery disease? Can the arteries actually clear up?
The answer is yes. It's good news for patients with coronary disease. We can't make all of the blockages go away. But by taking the right therapy, by reducing fat, by not smoking, we can keep the disease from progressing. We can make smaller blockages begin to get smaller. And we can keep patients from having heart attacks. We can cut the mortality from heart disease by 40%. Great news for patients with heart disease, Mike.
Thank you for joining us, Dr. Smith.
My pleasure.
And thank you for joining us. Remember, you can use the booklet that came with this program to review key points and to take notes. You'll also find a resource guide and a glossary of terms that may be helpful. And that concludes our series of reports on coronary artery disease. We wish you well.
I hope we have done our job and that you feel more comfortable with the diagnosis. The knowledge you have gained should help you prepare for the decisions you may have to make. It can also help you sort out any additional information you receive, whether it is from well-meaning friends or the evening news. Facing a medical condition involves taking personal responsibility. Responsibility for keeping in touch with your doctor and other health professionals and for following their instructions. And of course, responsibility for getting the support you need to cope with certain issues. For all of us with Time Life Medical, thank you for turning to us at the time of diagnosis.
To help you access important information that was covered in this program, you may refer to your personal workbook. You may also find additional information related to your situation in other Time Life Medical videos.